Mr. Jackson. This is Brandy, and she's going to be taking my place this morning.
Good morning.
Good morning.
Okay, so we're going to do a report, and I'm just going to tell Brandy everything that's going on with you, and any tests or anything that's going on today. Is that okay?
Yes.
All right, and if you have any questions, anything you need to say, just chime right in with us, okay? All right. Okay, Brandy, this is Mr. Jackson, and he's 75 years old. He is admitted to Dr. Barker under trauma services. He also has neurosurgery following him as well. What happened to Mr. Jackson is that he fell from standing, ended up with some altered mental status. He also has a subarachnoid hemorrhage and a left frontal scalp contusion. He has a history of hypertension, arthritis, and congestive heart failure. And is not allergic to any meds or drugs at this time. So, are you ready to start his assessment?
Yes.
Okay. All right. So for me last night, neuro-wise, Mr. Jackson could tell me his name. He knows the year. He knows he's at Erlanger. His pupils are equal and reactive to light. He can move all his extremities fine. Had good hand grips.
Squeeze my hands for me. Thank you.
Wiggles his toes just fine.
Very good.
He is currently on room air. Lung sounds were clear for me last night.
Just going to take a listen to you.
He's also not on telemetry. His heart rate for us when we did vital signs were 70s to 80s. His last blood pressure was 163/98. And for that, we gave him 10 milligrams of labetalol IV last night. And he's probably about due for a recheck here in just a little bit on his blood pressure. On the 22nd, Mr. Jackson went for a swallow study, which was yesterday because when he came in, he had a little difficulty swallowing. And so what was recommended was a pureed diet with nectar-thick liquids, for which he's been tolerating pretty good. Doesn't quite like the thicket.
Right.
His bowel sounds are active, no problems there. His last bowel movement was on yesterday, and he voids in a urinal.
Okay.
He also has a right inner forearm 22 gauge peripheral IV that was placed on the 22nd, and it's saline locked.
Okay.
We're not putting, not getting continuous fluids through it.
Okay. I'm just going to flush that real quick and make sure it's still working good for you.
We're not doing AccuChecks on him. He doesn't have a history of diabetes for us.
Does that feel okay? Is it painful at all?
No, ma'am.
All right. Thank you.
He has PT and OT following him as well, especially with the fall, the diagnosis of fall. It looks like today, Mr. Jackson, that case management will probably be in a talk with you, but it looks like you may get to leave today to go to rehab. So we're just waiting on financial approval. You've been approved medically and everything. We're just waiting on financial approval for you. So case management will talk to you and Brandy, and we'll come in and let you know what's going on. And also, we'll be doing hourly rounding, so someone from the nursing staff will be coming in every hour to check on you to see if you need anything and to make sure you're okay. And so if you need anything in between that time, you have your call light on the side of you, which Brandy's going to show you.
Right here.
And you just hit the red button on the end of that call light, and someone will come in to see what you need, okay?
And also another way to get in touch with the nurse, we have the nurse's name and the tech's name up here today and their phone number, so you can call that phone number also.
Am I still getting my water pill?
Well, you are getting Norvasc 10 milligrams for your blood pressure. You're getting Colace 100 milligrams, which is a stool softener. Your Simvastatin for your cholesterol. And I don't see your water pill. Do you know what it was called? I'll tell you what, I'm going to double check your Lasix. Well, I'm going to double check your home meds, and if I don't see it listed, we'll double check, and I can call the doctor to see about it. Is that okay with you?
Yes, ma'am.
Okay. Do you have any further questions for us right now?
When can I get out of here?
Well, hopefully that'll be today. We're waiting on the case manager to see about your approval to go to rehab. So they'll be in to talk with you here shortly. Okay? And if you need to get up for any reason, we want you to hit that call button, okay? Because you need assistance to get up, okay? We don't want you getting up by yourself.
Can I have something for my head? It hurts pretty bad.
Yes, I'll look at your medicines. What is your pain level from 1 to 10, 10 being your worst pain?
5.
5? Okay. I'll get over here and see what you can have for pain.
He has hydrocodone, 5 milligrams, ordered for every 4 hours as he
Okay.
needs it for pain.
All right.
So he can have that. It's been since midnight since he
Okay.
had the last one.
All right. Well, I'm gonna get your pain medicine and do some charting on you, and Tamara will be leaving for the day.
Well, thank
Okay.
you.
You have a great day, okay?
Yes, ma'am. You do
All
the
right.
same.
Thank you. Thanks for letting us take care of you.